Well, Hartford Hospital is once again getting national recognition for its cardiac care. The Society of Thoracic Surgeons, often called the STS, has given the hospital some of its highest ratings for cardiac surgery. And joining us to talk about what that means for patients is Dr. Sheila Pousaitis, a cardiac surgeon with the Hartford HealthCare Heart and Vascular Institute. Good morning.
Hi, good morning.
Well, for those who may not know, what are the STS awards?
Sure. So the Society of Thoracic Surgeons keeps a rigorous database of surgeries performed and their clinical outcomes. Most cardiac surgery programs in the country voluntarily submit their data, and then the STS takes that data, performs statistical analysis, and creates an average score for various clinical outcomes. And then, based on those scores, it's able to give programs a ranking of 1, 2, or 3 stars. 2 stars means that a program is clinically performing on average, where they would expect the patient outcomes to be. 1 star means below average, and 3 stars means that the program has exceptional clinical outcomes that are above the national average. They give out these rankings in 6 different categories: 1 for coronary artery bypass grafting, aortic valve replacement, mitral valve repair and replacement, aortic valve replacement with bypassing, mitral valve repair or replacement with bypassing, and then the 6th category of complex multi-procedural valves. So for the past 4 cycles where they have analyzed the data, Hartford Hospital has received a perfect score of 3 stars for all categories.
Well, that's great. The public may be more familiar with the U.S. News and World Report ranking. How's that different from the STS?
So it's a little bit different. U.S. News and World Report has their own formula. They do incorporate clinical outcomes into their formula, but they also utilize surveys that are conducted across the country from various physicians, patients, and hospitals. So the STS database is really the gold standard for looking at clinical outcomes, particularly mortality and morbidity, which are very important for patients and families.
What did Hartford Hospital do specifically to earn these great scores?
So it's really dedication to patient safety and quality outcomes. It's a team effort. It starts with our office staff working up patients for surgery, making sure that they're receiving the correct care, the correct preoperative workup. And then it moves to our actual operative team, where we have excellent surgeons and other team members who are providing that clinical care. Then they move to our ICU, which also provides exceptional critical care. And then our inpatient team, and finally our outpatient team that is going to help patients fully recover, return to their lives and their families.
Well, thank you so much, Doctor. We really appreciate it. For more information, go to hartfordhealthcare.org/heart.